Okay, so tell us your name.
My name is Susan, and I just had full knee replacement 8 days ago.
And so tell us about your pain. What have you experienced?
The only real pain I've had is about 18 hours after surgery when the narcotics, drugs, medicine wore off. I had a pain that I hadn't experienced yet, and I took my Oxy and my muscle relaxer, and it was gone within 20 minutes. And I have not had pain like that since.
Have you had to take those narcotics since then or not?
The only time I take the narcotics is at night when I go to sleep. So.
Susan, tell us what activities you've been doing since you had your knee replacement 8 days ago.
I have been walking as much as I can. I've also done the Robotic bike, which has helped tremendously. I'm at a level 3 out of 6. The doctor just increased my amount of time this morning, and I had one treatment this morning, and it went great.
And I heard that you're going up and down stairs already. Is that true?
Out of necessity to take a shower, and all the ingredients for that were upstairs. I thought, okay, I'm going to do a step to see how that goes. And I was able to go up 17 steps and take my shower upstairs.
Awesome. Is there anything else you'd like to share about your experience, or anything you want to share with someone who's might be thinking about knee surgery or is really scared?
Yes, because I was scared for over 2 years, and I walked around with my knee hurting. I couldn't do the normal activities. When we went on vacation to walk around a lot, I had to take a lot of breaks. And when I finally decided I had enough of that, Dr. Gough was the doctor to go to, because I knew he did it robotically and it wasn't as invasive as traditional surgery. So I'm so glad I did it. And I wish I would have done it 2 years ago. So if you're hesitating, don't, because it's so worth it to get it done.